In the ever-evolving landscape of health and wellness, few topics have captured the public's curiosity as much as the interplay between food and medication. Among the myriad of food-related questions, one that often sparks concern and confusion is whether it is safe to take medicine after eating fruits. This seemingly simple question unfolds into a complex discussion about how certain fruits can interact with various medications, influencing their effectiveness and potentially causing harm. While fruits are generally lauded as pillars of a healthy diet, brimming with essential vitamins, minerals, antioxidants, and fiber, they are not entirely without potential complications, especially for those who rely on regular medication. This topic is particularly relevant in a world where chronic diseases like hypertension, diabetes, and high cholesterol necessitate the daily intake of pharmaceuticals. A closer look at the interactions between certain fruits and medications reveals why a one-size-fits-all approach cannot be applied and why careful consideration is required for maintaining both nutritional health and medication efficacy. The cornerstone of this discussion is an understanding of how certain bioactive compounds present in fruits can interfere with the way medications are processed in the body. Grapefruit, for instance, is a prime example of a fruit that can significantly alter the metabolism of various drugs. Containing compounds known as furanocoumarins, grapefruit has the ability to inhibit a key enzyme in the liver, cytochrome P453A4, CYP3A4, which is responsible for the breakdown of many common medications, including statins, blood pressure drugs, and certain antidepressants. This inhibition can lead to higher concentrations of the drug remaining in the bloodstream for longer than intended, potentially resulting in dangerous side effects. It is this enzyme-inhibiting property that has earned grapefruit its reputation as a notorious fruit to avoid when taking specific medications. Consider the scenario of a patient prescribed a statin to manage high cholesterol. Statins, which help reduce levels of bad LDL cholesterol, are metabolized by CYP3A4. If this patient regularly consumes grapefruit or drinks grapefruit juice, the inhibition of CYP3A4 means the statin levels could build up in the bloodstream. This accumulation raises the risk of adverse effects, such as muscle pain or even a rare but serious condition known as rhabdomyolysis, in which muscle tissue breaks down, potentially leading to kidney failure. The risks associated with grapefruit extend beyond statins, affecting calcium channel blockers, medications used to treat high blood pressure, resulting in blood pressure levels dropping too low, leading to dizziness or fainting. Grapefruit is not the only citrus fruit that warrants caution. Oranges, particularly Seville oranges, commonly used in marmalades, contain flavonoids that can similarly influence how certain drugs are processed in the liver. Although the effects of oranges are generally less pronounced compared to grapefruit, individuals taking medications such as statins or blood pressure drugs should still exercise caution. This underscores the importance of knowing precisely which citrus fruits pose a risk and in what context. Beyond citrus fruits, other common fruits can interact with medications in significant ways. Take bananas, for instance, a favorite fruit that is rich in potassium. For most people, potassium is beneficial for maintaining fluid balance, nerve function, and heart health. However, for those taking certain blood pressure medications, particularly angiotensin-converting enzyme, AC, inhibitors, or potassium-sparing diuretics, bananas could pose a hidden risk. These medications already have the effect of increasing potassium levels in the body. When a potassium-rich food like bananas is added to the mix, it can lead to hyperkalemia, a condition characterized by dangerously high levels of potassium in the blood. Symptoms of hyperkalemia can include muscle weakness, fatigue, and in severe cases, life-threatening arrhythmias or cardiac arrest. For patients managing hypertension or heart failure with these medications, a conversation with a healthcare provider about dietary potassium intake becomes essential. Pomegranates also occupy a place on the list of potentially problematic fruits. While known for their high antioxidant content and cardiovascular benefits, pomegranates can inhibit certain enzymes involved in drug metabolism, much like grapefruit. Additionally, they may increase the risk of bleeding when taken with blood-thinning medications like warfarin. The potential interaction between pomegranate and these medications may elevate the risk of adverse outcomes, especially in older adults who are more likely to be prescribed anticoagulants to prevent conditions such as deep vein thrombosis or stroke. Fiber-rich fruits present another interesting dynamic in the relationship between diet and medication. Apples and pears, packed with soluble fiber like pectin, have long been celebrated for their digestive health benefits. However, this fiber can bind to certain medications in the digestive tract, reducing their absorption and ultimately their effectiveness. Medications like levothyroxine, a commonly prescribed drug for managing hypothyroidism, can be less effective if taken alongside high-fiber fruits. Patients may experience suboptimal thyroid control, which could manifest as persistent fatigue, weight gain, or other symptoms of an underactive thyroid. The timing of medication is critical here. Taking levothyroxine on an empty stomach and allowing at least an hour before consuming any high-fiber foods can help mitigate this issue. The influence of fruits on medication is not limited solely to enzymatic interactions or the binding effects of fiber. Vitamin C-rich fruits, such as oranges and strawberries, can enhance the absorption of iron from supplements or iron-rich foods. For individuals dealing with iron deficiency anemia, consuming a glass of orange juice with their iron supplement can significantly improve the supplement's efficacy. However, there is a delicate balance. Too much vitamin C can sometimes cause gastrointestinal discomfort when taken with iron, and some people may need to adjust their intake accordingly. For those managing diabetes, fruit interactions pose a different kind of concern. Fruits naturally contain sugar, and while their impact on blood sugar levels is moderated by fiber content, it's still important for diabetics to consider the timing and portion sizes of fruit intake. Medications like metformin, commonly prescribed to manage type 2 diabetes, can be influenced by the timing of food intake. A high-fiber fruit like an apple could slow down the absorption of metformin, reducing its blood glucose-lowering effect. Diabetic patients are encouraged to work with healthcare professionals to develop a diet plan that supports consistent blood sugar management while considering medication timing. One of the biggest challenges in managing fruit and medication interactions lies in the variability between individuals. Factors such as age, liver function, and even genetics play roles in how a person metabolizes drugs and how sensitive they might be to certain interactions. For instance, older adults often experience a natural decline in liver and kidney function, which can impact drug metabolism and clearance. This means that older adults may be more susceptible to adverse effects when fruits interfere with medication processing. Additionally, the presence of multiple chronic conditions can complicate this dynamic. Older individuals are more likely to be taking multiple medications, increasing the chances of drug interactions, not only with fruits, but also with other drugs. The role of healthcare providers is crucial in navigating these complexities. Doctors and pharmacists are well equipped to provide guidance tailored to individual needs, taking into account the medications a patient is taking, their diet, and other health conditions. Pharmacists, in particular, can play a vital role in educating patients about potential food-drug interactions, offering practical advice on timing and food choices. For example, they may suggest taking medications at least 1 to 2 hours before or after eating a potentially problematic fruit, allowing sufficient time for the medication to be absorbed without interference. While healthcare professionals provide essential guidance, patients can also take proactive steps to reduce the risks of fruit and medication interactions. Reading medication labels carefully is a basic, yet often overlooked measure that can prevent issues. Many prescription and over-the-counter medications contain specific instructions regarding food, whether to take the medication on an empty stomach or with food, or to avoid certain foods altogether. These instructions are not arbitrary. They are based on how the medication is absorbed, metabolized, and eliminated by the body. Another important consideration is the form in which fruit is consumed. While whole fruits are generally more beneficial due to their fiber content, fruit juices, particularly grapefruit and pomegranate juices, pose a higher risk of interaction. Juicing removes much of the fiber, concentrating the bioactive compounds and potentially increasing their effect on drug metabolism. For patients who are advised to avoid certain fruits, this recommendation typically extends to fruit juices as well. Beyond the pharmacokinetic and pharmacodynamic considerations, it's essential to acknowledge the broader implications for health and wellness. Fruits are an irreplaceable part of a balanced diet, offering a wealth of nutrients that support immune function, heart health, and digestive health. Their exclusion should only be considered when absolutely necessary and under medical guidance. In many cases, the solution lies in modifying timing or portion sizes rather than complete avoidance. For example, a patient taking a blood pressure medication that interacts with grapefruit may still be able to enjoy other fruits with similar nutritional benefits, such as apples or berries, without risking their health. The interaction between fruits and medications serves as a reminder of the intricate relationship between diet and health, a relationship that requires both awareness and respect. As our understanding of these interactions grows, the need for individualized healthcare becomes even more apparent. Each person's health journey is unique, influenced by genetics, lifestyle, and medical history, and navigating food-drug interactions is no different. A tailored approach, guided by healthcare professionals and informed by a thorough understanding of how foods can influence medication, offers the best pathway to maintaining both health and the efficacy of necessary treatments. In conclusion, the question of whether it is safe to take medicine after eating fruits does not have a simple yes or no answer. It depends on the type of fruit, the medication involved, and the individual characteristics of the patient. Fruits like grapefruit, oranges, bananas, and pomegranates have specific properties that can alter the way drugs are metabolized and absorbed, sometimes with serious consequences. Awareness of these interactions, careful timing of medication and fruit consumption, and consultation with healthcare providers are all essential steps in managing these risks. By taking a thoughtful approach to both diet and medication, individuals can enjoy the health benefits of fruits while ensuring their medications work as intended, achieving the ultimate goal of holistic well-being. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss out on our latest health and wellness tips. Remember, understanding the interaction between your diet and medications is key to staying healthy and safe. Stay informed, stay healthy, and until next time, take care.